Hi, my name is Vincentia Johnson, and my portion will be starting with the introduction. No doubt you've heard of the term opiate epidemic. It gets thrown around on the news. The opiate epidemic, also is known as the opiate crisis, has become a hot bottom issue everywhere: social media, blogs, newspaper, nursing journals, etc. However, many may not know what the crisis actually is. The opiate epidemic specifically refers to the growing numbers of deaths and hospitalizations from opiates, including both prescription and illicit drugs. In recent years, deaths from these drugs have skyrocketed. According to the Centers for Disease Control, in 2019, over 400,000 a year, or can I say 115 deaths a day across the US from drug overdose, is now the leading cause of accidental deaths in the United States, largely due to the opiate epidemic. The opiate epidemic first gained its notoriety around 2010, but the factors behind it began several years earlier. Despite the recent increase in public awareness, the opiate epidemic, the background of this epidemic is still disproportionately unknown to the public. This epidemic, it is a global crisis which impacts not only individuals' well-being, but our economy, not only in the United States, but it is a global problem. In fact, many may wonder, how did this happen? It's crucial for people, not just in the United States, but everywhere, because this is a global problem. But it's also crucial for the next generation, our children and our children's children, to understand the fundamentals of this epidemic. The epidemic, it's a multifaceted problem. Its roots and its progressions are entangled within the medical and social issues that has spanned for years. So you want to know when and how this opiate epidemic developed. It's crucial for people worldwide, not just in the United States, to know and understand the fundamentals of this epidemic. So the historical background: there's not one factor that is to be blamed for the opiate epidemic, but there's a very precise sequence of events that accelerated the rate of this problem. Starting back in the 1990s, there was an outcry in the medical community that not only was the pain level of its patients underassessed, but it was also untreated and it was misunderstood. So this actually set the stage for what many consider to be the initial step leading to our current problem, this epidemic. Pain being introduced as the fifth vital sign. The Joint Commission revised pain standards and allowed this with the fifth vital sign concept. These new standards have required that a patient's pain was to be assessed on every doctor's visits. The best tools were, these tools were to be available for these patients, and they were to be properly documented. Physicians now had to ask how much pain a patient was in during every visit, and they had to document it. Because of reaccreditation was a factor, patients would base, as far as the adequacies of their services by these providers, whether or not they were able to prescribe pain medications or not. Physicians began assessing every patient for any type of perceived pain. Frequent evaluations was done in order to meet these progress guidelines of adequately, properly medicating these people so that their pain issues can be alleviated. The reason behind this was that if a patient was completely pain-free and verbalizes during every encounters, the physicians, now get this, would not face any type of disciplinary actions, and they would be able to be reaccredited. Next, we entered the pain mill. according to the Florida's Office of Attorney General in 2015. The term pain mill defines as a doctor's office, clinic, or healthcare facility that routinely conspires in the prescribing and dispenses of controlled substances outside of the scope of prevailing standards of medical practice in the community or violates the laws of the state. These unscrupulous physicians noticed this population of patients that require strong pain relief, essentially, and they took advantage of the situation. These opportunist physicians set up independent pain management centers, often accepting cash only, and allow patients to receive their drug of choice. These and similar practices throughout the country set the foundation for the current problem we have today. Unethically prescribing medications that not only had a high likelihood of addiction when given over long periods of time, but also falsely giving the impression that these medications would always be available for these patients. In response to the rapid increase in rate of overdose and deaths related to prescriptions opiate, according to Baker 2016, the Joint Commission removed the requirements to assess the fifth vital sign. When Purdue Pharmacy paid a settlement amount of over $600 million for misbranding OxyContin in 2007,